Um, one thing that I've been, asking some different consultants is, different approaches and different ideas regarding knee replacement surgery. So, first question I've got for you is, in your practice and in your opinion, where do you sit with kind of robotics versus non-robotics in terms of, do you use it, don't you use it, merits versus, you know,
Yeah, it's a fascinating topic to look at. So, for the benefit of your viewers, knee replacement surgery has evolved and progressed over the last 30 years remarkably swiftly, and the drive for progress in knee replacement surgery is very much as a result of our joint registry data. So we know thousands of people have knee replacements, but we are well aware that a percentage of people are never satisfied with their knee replacement. Something like 5 to 10% of people, I mean, different figures are bandied around, but you can ballpark figures say that something like 5 to 10% of patients, even a year, 18 months, 2 years after a knee replacement, they're not satisfied. And fair enough, some of those people are not satisfied because they've been unfortunate. They've had maybe a complication of surgery, infection, bleeding, unusual stiffness of the joint. But there's a percentage, a hardcore percentage of people where the operation goes fine, the x-ray looks fine, the wound heals up fine, the knee moves fine, but the person is not satisfied. And that has been a major driving force for us to look for ways to improve our patient outcomes. We want 100% of people to be satisfied with their knee replacement. Now, some of those people may be dissatisfied because expectation comes into this. When you do a lot of hip replacements and a lot of knee replacements, what you realize is that the hip replacement patient, by and large, is satisfied. The hip is a ball and socket joint. The biomechanics, the basic principles are fairly straightforward. The knee is much more complicated. Although you might think of it just as a hinge joint, it's not just a hinge. It's what we call a sloppy hinge. So it does flex and extend, but you have sideways movement, you have rotational movement, you have the kneecap to deal with, the balancing of the ligaments. These are all essential parts of how a knee works and how it feels. And when you have a knee replacement, unfortunately, even a good knee replacement, although it may well take away the pain of the arthritis, a lot of people will say, I know it's not my own knee. I can feel it's a bit clunky. It doesn't quite feel the way my own knee felt.
Yeah.
And so we've done a lot of work to, as an orthopedic community, to try and work out what we can improve to make that patient feel more satisfied. And robotic knee replacement surgery is one facet. There are changes that you can make to the implant itself to try and improve the way the kneecap moves as it bends and straightens, to improve flexibility of the knee. There are ways that you can try and improve alignment and positioning of the knee replacement. And robotics is one of those methods. Now, we've tried robotics before. 10, 15 years ago, there was a fad more in the US for using robotic surgery. The technology then wasn't really up to scratch. Those robotic systems were they weren't very user-friendly for the surgeon. Yeah. And so quite often you'd start doing an operation using a robot to assist you, and the software would crash. You'd be waiting, and then you realize that you weren't getting anywhere, and end up saying, well, that's not really working.